Hi, my name is Dylan, and this is Stories, Jim, and Wendy. It's our pleasure to be here today. We have an informative presentation for you. Our topic is what can other countries learn from Taiwan's experience in quality health and medical care? Let us begin. First, I will introduce our outline. There are 5 parts in our presentation. The first part is introduction. Next, we will introduce the medical care of Taiwan. After, we will explain why can Taiwan stand out in the world. After that, we will talk about the Taiwan WHO action team. And finally, we will share our conclusion. For Taiwan, infectious diseases are like cancers that will never disappear. Whether it started nearly 20 years ago or the new coronavirus that is now raging around the world, Taiwan's government can make effective policies to control the harm of virus to the people. 3 days after the first new coronavirus was diagnosed, Taiwan banned the export of masks to prevent them from being bought by foreign tourists. At the same time, a real name mask system was introduced to make sure that each Taiwanese can be equally distributed to a certain number of masks. As for those Taiwanese who came back from other countries will be implemented to home inspection, and those had contacted with the diagnosed will be implemented to home quarantine. And for those businesses or restaurants that do not have good yield due to the epidemic, they set up a bailout budget so that they can get some economic buffers. In addition, what reaches the people most is that the government has kept the epidemic information being known to the public, holding a press conference for more than 1 hour every day from time to time. His Minister Chen Shizong, head of the Epidemic Center, answers all questions from the education to the economy. That's the end of my presentation. Thank you.
Hello, my name is Doris, and I will explain medical care and superiority about Taiwan. Taiwan has one of the world's best national health insurance systems. The nation has gained an excellent international reputation for its state-of-the-art medical. In 2014, CNN hails Taiwan's medical achievements that Taiwan provides prompt and high-quality medical services for an affordable cost. For example, the total fee of CABG in Taiwan is only 1/5 of that in the United States, and the expense of knee-hip joint replacement is 40% cheaper than in Singapore and Thailand. Taiwan indeed provides high-quality health care at very competitive prices compared to all countries in the world. Taiwan's excellent healthcare systems owes its success to 6 main strengths: high quality, technology and innovation, patient-oriented service, leading physicians, comprehensive specialties, and affordability. Thank you.
My name is Jim, and I will provide an explanation to the issue of the topic. First, I will explain why can Taiwan stand out in the world. Since the SARS outbreak, people in Taiwan have realized that the most important thing is not only the treatment of patients and how the government handle the disease, but also the people's sense of self-protection. As SARS taught us, it is not enough to rely on the government and the medical system alone. If we can protect ourselves since an outbreak, we can reduce the chance of getting infected. So, when this COVID-19 outbreak happened, people of Taiwan were well prepared and had enough knowledge of epidemic prevention, with the world's news reporting a dismal death toll. The people of Taiwan can say to themselves with relief that we have done it. A country that is isolated, suppressed by big power which keep us away from WHO, was the most visible and admired star of the epidemic. Thank you.
Hello, my name is Wendy. Let me explain our last slide. Exactly. Without a doubt, we would never see the stars. And I'll say, although Taiwan was unable to formally attend the WHO due to political interference, Chen Shizhong still led the Taiwan WHO Asian team travel to Geneva and share the achievements and contributions of Taiwan's medical and health services with allies for bilateral talks. Moreover, signing an emergency medical cooperation memorandum with the University Hospital of Geneva and contributed to international medical care in professional, pragmatic, and constructive ways. The academic prevention work has received the attention and press of many foreign media to increase the opportunities for our country to participate in WHO. Although our land area and the population are inferior to America, our government and healthcare system have made it admire and learn from us. There is no easy answer to the topic. However, based on our presentation, we have come to the conclusion that the most powerful element in Taiwan's quality health and medical care is knowing. Taiwan has been affected by the epidemic many times and laid a good foundation for our medical care. Through the epidemic prevention actively and proper treatment of patients, they can let our country survive the crisis in the past. And I believe we can make the world better and we can start from ourselves. It's our references. This is our presentation. We hope you enjoyed it and are able to follow our reasoning to this topic. We thank you for your attention, and if there are any questions, please feel free to ask. Thank you.